safety community. I am Jason Karp, Esquire, with my good friend and colleague TJ Kennedy for the next episode of PSN at Home, where we are featuring our esteemed guest, Doctor and Police Officer Dr. Alex Eastman. TJ, you want to tell us a little bit about our esteemed colleague here?
Absolutely. So Dr. Eastman is a unique blend of a lieutenant with the Dallas Police Department, but has spent many years as a trauma surgeon at Parkland Memorial Hospital, and has been both a professor. He has a background in public health. He has a master's in public health, and he is extremely involved in efforts both at the national level and at the local level in law enforcement as well as emergency medical services, and brings a terrific background. Both Alex and I have worked on SWAT teams in the past and have dealt with that, me from a paramedic perspective, Alex obviously as a trauma surgeon, but bringing that unique perspective to law enforcement and law enforcement operations. And I think it's such a critical time for us to be able to touch base on that. So welcome to the show today, Alex. Appreciate it.
Thanks a lot, TJ. Great to be here with you guys.
Yeah, and just as you all will notice, Alex is currently in a vehicle. He is actually on the job as we are talking right now, which is very exciting, and doing what he does best and combining law enforcement with his medical background. Truly unique, from certainly in terms of public safety and engaged in first response, and it's been worked at both the local, state, and federal level. So just tremendous amount of insight, that you can bring to the table. But would love to just kick this off and get a sense, doing with both the law enforcement background, trauma surgeon background, you're still doing both jobs. Give us a sense of that unique perspective.
Yeah, I think, Jason, it's the nexus of the three of law enforcement, public health, and high quality trauma care is really one that's relatively unique, and it requires specialized expertise in each space. There just simply is not enough. There's not enough work being done at that interface, and I think this is there's never been a more fascinating time to try to work in it. I mean, we're in the midst of unprecedented protest, reform, unrest in cities and communities around the country in the face of, in our fifth month of managing a worldwide pandemic and the public safety response to that. So I can tell you that over the last several months, it's truly been an absolutely eye-opening experience for me. And this is my 17th year of doing both jobs. So truly, absolutely eye-opening.
So Alex, when we reached out to you, it was because of exactly the reasons you just mentioned. I mean, there could not be a more prescient time in our country where the need for quality medical insight into both the pandemic, into law enforcement, into emergency medical services could be more important. And I have this feeling that our country needs a lot more Alex Eastmans. We need a lot more Dr. Eastmans out there. And so I'm going to ask you an odd question. If you could change the way that we recruit talent into law enforcement agencies, we recruit talent into hospitals that are willing to work with public safety in a more intrinsic way, how would you redesign that? How would you put that out there so that when people are considering medical school, they consider a career that really is dedicated to emergency medical services, as well as potentially law enforcement? And how do we get more people so we can have more Dr. Eastmans out there that understand this, and especially with the public health background, because it's such an important element of it?
Yeah, so TJ, I would say there's probably a couple of folks around that might argue with you that we don't need any more Alexes lurking about. But I appreciate the sentiment, and I think the point is well made, and that is that for so often these three career paths have been separate and distinct, and I think what's really become apparent, and certainly at the law enforcement agency level and at the big city agency level, it's become pretty apparent that those things don't exist in a vacuum at all. And that much of what we do has at least a touch point, if not a nexus, to each of those three disciplines. And so I think that what we have to do is show people as they begin to choose their career path that, for me, my passion and my interest has always been around public safety. And there was a period of time when I was a traditional trauma surgeon running a big academic trauma center that I thought that those two things might potentially get in the way of another. But I think one of the things that we've laid out pretty clearly is that you can do all of the above. And so, we have to continue to develop novel training programs and novel partnerships and have, I think departments all over the country, law enforcement agencies and departments really are just in their infancy of developing their sort of medical programs and realizing they need to have embedded medical expertise. And so I think that's, we've got to continue to help spread the word and continue to help develop programs all across the country.
Excellent point. And I mean, it just could not be a more ripe time for this conversation, right? I mean, and, we recently had a guest with Billy Goldfeder in the fire service to talk about recruitment in the fire service and some of the unique issues that they're facing with EMS and the confluence of all three disciplines, kind of coming together now more and more. Well, I mean, we are in an environment today where that is going to happen. It's going to become more of the ordinary course. But oftentimes, in response, you might have one or the other of an agency be first to a scene. And oftentimes it's law enforcement, especially in the times we're looking at right now. What are your suggestions when you're working with law enforcement agencies and you're talking, this message is going out to law enforcement agencies all over the country, in terms of how should they be training their officers when it comes to the medical aspect of this, being able to balance that law enforcement and that kind of medical, obligation to cure, given this is likely going to become much more of the new normal. I mean, what would you say to them? What should they be thinking about?
Yeah, Jason, I think they should be thinking about the fact that the traditional public safety disciplines, fire, law enforcement, and EMS, no longer operate in a vacuum. And while I don't think we necessarily need to have every public safety provider be cross-trained across the public safety spectrum, we do need to be able to work together better than we ever have before. And I think, the old buzzwords of interoperability and those sorts of things don't really tell the tale of the way that and certainly, if some good comes out of this coronavirus pandemic, the lessons that have been learned that in terms of departments and agencies needing to be better integrated than even I would say after 9/11, the idea that we have to continue to better integrate not just planning and policy, but actual operations, really makes a huge difference in the way that you respond to anything, whether it's coronavirus or a large peaceful protest or massive amounts of unrest and violence. Those, and we've seen them all here in Dallas in the last week alone. And so, I think the days of us operating as independent, truly independent entities should probably be over, and we should be much more interlinked. I also think that helps us with recruitment because the job looks very different today than it did even, 5 years ago.
No, that's really important, Alex. I think you're hitting on a point too, that we need to train together, we need to plan together, we need to operate together. And part of that comes down to communications. You mentioned, interoperability. I always like the word operability because it should just work. We all should be working together each and every day, just like you explained. And I think that's even more important. I think the other thing is we need to leverage technology to help us communicate better. You're clearly a user of broadband technology and using it every day in what you do. What kind of technologies are you seeing today, or what kind of technologies would you like to see that you don't yet have that you could share with us? I mean, I think there's a lot of things that work well, and I think there's a lot of new needs as well. What are your thoughts on that?
Yeah, that's a great question, TJ. And I think as we've noticed, and I've felt the acute need to be in many places at the same time, and I know if you noticed yesterday, CMS just did some work on on relaxing some of the rules associated and regulations associated with telemedicine now. But I think, a real-time telemedicine capability would be, and one that really works. It's got to be mobile and easy to use, and I can't be, obviously, as you see where I'm talking to y'all from, it's hard for me to be confined to a computer console. It's got to be a mobile platform, but a real telemedicine platform, so that I can see what people are seeing, what my guys are seeing, and men and women that are working with me, both here in Dallas and for DHS, literally around the world. The ability to see that only allows me to help, just like I was, which is what I would like to be doing, which is standing right next to the provider as they care for someone in the field. And so I think those technologies, the broad application of broadband technology, and we once had this very conversation just a couple of blocks from where I sit right now here in Dallas, you and I, over a cup of coffee, that the future of communication in the public safety space just has to look so different. And quite frankly, we are most places, most big public safety agencies are relatively slow adopters of that, but we've got to really make a move to try to get some of those technologies out and deployed, and I think it's going to revolutionize the way that we do business.
Your perspective on this is incredible, and it's, our police officers, our firefighters, our paramedics, our EMTs, they deserve more. They deserve better technology today. And it's not a criticism as much as it's an urgent call to action. I think we need to push folks to empower our first responders with the right tools. And to your point, telemedicine has been around for a long time. We just haven't enabled everyone with the portable platforms to make that happen. And also, it goes to both sides. You're talking about the physician side as well as the paramedic, police officer, firefighter side, and it has to be on both sides. Everyone has to be connected all of the time. Everyone has to have the ability to send two-way video. Everyone has to have the ability to leverage the cloud as they're doing this, because there's a lot of these things that can be automated to help as well. And whether it's sending vital signs or other critical data of either a first responder or of a patient, all of these kinds of sensors and technology pretty much exist today, but just have not been fully implemented. And I think it's time to move quickly.
And I think that's right. And I think the first person who puts that into a neat, succinct package that's relatively affordable for the public safety agency is going to revolutionize this space, and we'll be able to do things, I think, that we maybe even haven't imagined yet.
Absolutely, and you hit on it, right? This is kind of the new normal, right? I mean, now with the pandemic, and yes, we fully expect there'll be some level of prevention, whether it's a vaccine or something in the future, but we all know that this is the future, right? We're going to be fighting these kinds of things with our global economy, with travel, with the morphing of these viruses, so quickly. This is just something we're going to have to deal with, and I think it's really accelerating the need to be able to effectuate your job from wherever you are, to have that telemedicine capability, which and interagency, right, and interdisciplinary. So we were talking about how, the crossing of these different agencies, and in law enforcement, have to have some semblance and understand of healthcare and the health system and how that's going to work, and working together with these agencies. So these technology platforms have to work across all of the different disciplines,
Absolutely.
all the different agencies. They need to be, trained in them. And at the base of all this, right, is connectivity. And that's really, at the end of the day, really, really key. And I'd love to hear, your thoughts on that. But in order to do this, we have to have reliable broadband, next generation connectivity, wherever first responders need to be. And we're getting there, and we've seen tremendous progress. But it seems to me that that's just going to be critical in order to get the kind of throughput and get the information where it needs to be in this. It's really kind of our new world order here.
Yeah, I mean, I think one of the things that's fascinating about this whole, about the pandemic and the response, and how our country has really adapted, and not just public safety agencies, but businesses all over the country have adapted to the virtual presence. And I think it exposed, some of the the weaknesses in our current broadband infrastructure that we have to really improve, because I think you're right. We will respond to more of these and more of these. Well, first of all, we're still responding to this one, but we'll respond to more of these as in the coming years, and even some maybe that we haven't thought of yet.
No, well said. And we know how busy you are with what's going on in Dallas today, and your busy work and multiple roles that you play. All I can say, Alex, is thank you for joining us. We really appreciate you sharing your thoughts and ideas, and you're a true leader in what's happening with public safety and emergency medical services, and we really appreciate all you're doing.
Absolutely.
Well, thank you to both of you, TJ and Jason. You guys be safe, and hopefully we can do this again when I'm sitting in a place that's a little bit more comfortable.
No, we understand. We appreciate you making it happen today. Be safe out there, and good luck.
All right, gents. Have a good one.
Thanks so much.
Yep. Bye now.
Bye-bye.